Tennessee This Week from WATE's 6 on Your Side starts now.
The race for state Senate and District 7, you have heard from the Democratic challenger. Now we are sitting down with the Republican incumbent. And our final statewide debate, the candidates for governor going head-to-head. Plus an onslaught of negative ads in the Senate race coming up on Tennessee This Week. Hello, everyone, and welcome to Tennessee This Week. I'm Kristen Farley. We are hitting another race on the ballot right now as people here in Knox County take part in early voting. Already on Tennessee This Week, we have heard from one of the District 7 state Senate candidates. We're talking about Jamie Ballinger. She was our guest just a few weeks ago. Well, today we are hearing from the incumbent in that race, State Senator Dr. Richard Briggs. Dr. Briggs, thank you so much for joining us.
Glad to be here.
Glad to see you. Let's go ahead and talk a little bit about this race and a little bit what you've accomplished. You're the incumbent, so remind people at home some of the big milestones and accomplishments so far for you.
As some of our viewers may know, I'm a medical doctor, and taking the expertise in many years, I've been a doctor now for 41 years, to Nashville, I think I've been able to add a lot. And some of the polling and some of the things we're hearing on our door-to-door is that health issues and health care seems to now be the #1 issue. And it deals with the cost of health care. It deals with the opiate crisis, which is much larger than some of the personal tragedies that we see. It deals with mental health. And I saw where just a day or two ago out at Gibbs High School, they found another student that's committed suicide. We had 3 at Farragut High School the spring before last. And so I think these issues that we have, I've been able to be a leader on the health issues, particularly on the opiate crisis. I had some bills, it was a series of bills that closed about 50% of the pill mills in the state of Tennessee. I had a suicide bill that I passed that mandates that any of the licensed counselors also have to have training every other year in recognizing people that may have suicide tendencies. So I think I bring a lot to the table on that, in addition to some of my other bills. You
were part of that debate over in Shore, Tennessee a couple of years ago, ran into some roadblocks there. So let's talk about where you want to see health care coverage go here in Tennessee.
Well, back in 2005, 2006, and 2007, Governor Bredesen, because of budget problems, had to disenroll nearly 300,000 people from insured Tennessee. We had nearly 100% coverage up until then, and it was because of budgetary difficulties. Governor Haslam found a way through Insured Tennessee where we could bring those 300,000 people back into the TennCare, and it was not going to cost the taxpayer anything. I've been very concerned about access to care, and even when we're dealing with mental illness or the opiate crisis, there's no way that the state can afford any of the rehabilitation that's required. Much of that requires 90 days of inpatient. And the only way that we can look at trying to try to find rehabilitation, mental health issues, and the access to care is through expanding the Medicaid. And I actually sponsored Insured Tennessee all of the last 4 years.
And obviously, as you said, health care is still a #1 issue for so many people, and still struggling with health care coverage right now in our state.
Yeah, that's what we're hearing. Vanderbilt does polls twice a year, and a few years ago when we were still recovering from the recession, jobs were the #1. Well, now those lines have crossed, and health care is now the #1 issue.
So if you were to continue to back expanding Medicaid, how would you plan to pay for it? That's always the big issue. How do you pay for it?
Well, we actually found a way to pay for it. Governor Haslam and I've met several times with the Tennessee Hospital Association, and by the year 2020, the federal government was to pay 90%, but the state would have to pay about 10%, which would be somewhere in the neighborhood of $120 million. Because we have so much uncompensated care in the state, is what we can do is the Tennessee Hospital Association said we will put a tax on ourselves, and we will cover that part, the $120 million, and that way we could draw down $1 billion to $1.2 billion a year from the federal government. That can help us give access to care. That can help us with some of these rehabilitation services, with mental health issues. We're a very unhealthy state, and a lot of it is that there's so many people that can't see doctors.
How do you push this through? How do you get this and get your fellow colleagues to get on board with you?
We were talking before we went on about one of the debates that they had at the governor level, and I know that Mayor Dean from Nashville said the Republicans don't have a plan B. I've got a plan B and a plan C. Insure Tennessee being the Plan A, which I think is good. And what it is with the new administration, I've made 2 trips to Washington, D.C. and met with the people at the Health and Human Services, is one, we could look at per capita block grants. We would have to have some of the minimal essential benefits removed so the state can manage the pharmacy benefits. We need to have the recipients to have some skin in the game, have minimal, maybe $20 a month for the working poor, not the true people in poverty, where they have to pay something, and then also have minimal co-pays. I think we have an opportunity if we apply. They call these the Section 1115 waivers. That I know that President Trump has instructed CMS, which is the organization that has to approve the waivers, to look favorably at these. No state has done it, but that was something that we could look at.
All right, let's go ahead and move on to another issue. We have seen a lot of leadership shakeups at UT, from the athletic director to the chancellor to the selection of a new interim president just a few weeks ago. What do you think about where UT is headed? And really, most importantly, what do you think the relationship between the university and lawmakers should be? Because a lot of people would say it's been pretty contentious over the last couple of years.
Sadly, I'd have to say it has been very contentious. We really have a couple of elements there that we're talking about. We're talking about the legislature, we're talking about the Board of Trustees, we're talking about the administration, and we're talking about the students. I'm an optimist. We have an entirely new Board of Trustees that we didn't have before. We've got a brand new president who, quite frankly, I think is a wonderful person in Randy Boyd. We're going to have the largest turnover just about in history in our legislature. So I think this is a rare opportunity for everyone to try to start off new and on a fresh foot and see if we can't establish a working relationship rather than a contentious relationship with the university.
How much should lawmakers get involved with what's going on at UT?
I may differ from some of my colleagues. I don't think we need to be micromanaging a lot of what happens at the University of Tennessee. We do, and the Tennessee taxpayers do fund the university. It's now about 23%. If you go back to the 1980s, it was probably closer to 60 to 70%, and so that part's changed, and that's also why the tuition has gone up so much. I personally don't like the legislature trying to micromanage on all the little incidents that come up. Yeah, we can question some things, but I do have a lot of faith in the Board of Trustees, and I have a lot of faith in the administration.
It'll be interesting to see where that relationship goes.
It'll be very interesting to see where that goes.
Let's talk about improving and securing schools. There's been so much talk about that. We've seen a lot of emphasis recently. We've seen even more and more money put into these efforts. What do you think still needs to be done, and what do you feel about putting more money towards having safe schools?
You know, that question gets asked a lot, and I'm going to ask the question that you didn't ask that I thought you would ask, and it has to do with teachers having guns. I mean, there's a lot we can talk about.
You had to give me a chance to get to that point.
I know, but I thought that's what you were going to say. But what I'll say on this is that we have the FBI that's studied every school shooting. We have professors at universities that are specialists in this. We have experts on school safety. What I think the role of the legislature should be is to listen to what those experts say that needs to be done, and then our responsibility is to fund it. I don't know. I'm not an expert on that, and there's not one person in the state legislature that is. That's what we need to do, rather than us trying to be experts on something we know nothing about.
So are you saying if those experts came back and said you should be arming teachers, that is something you would get behind?
If they came and said this is what we need to keep our students safe, I'm going to go with what the experts say.
Okay. One last question. What are you looking for in Tennessee's next governor? Of course, we don't know who that's going to be at this point, but what would you like to see in terms of the relationship and what they are seeking to accomplish?
You know, the last 8 years has been a tremendous amount of progress that Tennessee has made in bringing high-paying jobs to the state. We have the lowest unemployment rate that we've ever had in the history of recorded in the history of the state. We've made the most rapid progress in our schools. We're still not that great. We're up almost to the middle of the pack. We've got to continue that. We need for the state of Tennessee to continue to have an environment that's very positive, where businesses want to come here and create jobs. We've got to have the workforce that deals with education for those high-paying jobs, and we have to agree as citizens of the state of Tennessee that those things are very, very important, and then we need to do them.
All right. Dr. Briggs, we appreciate your time today. Thank you so much.
Thank you very much for having me.
All right, and best of luck for the rest of campaigning.
Thank you.
So to come, everyone, another debate and more attack ads on the airwaves. The election cycle heads into the next phase as voting begins. Our panel of pundits coming up next. Stay with us. You're watching Tennessee This Week on WATE 6 on your side.